I am Dr Neema Bisht, BDS by degree and a pharma professional. Also, I am founder of CareerInPharma, wherein I provide guidance and training to healthcare professionals. I am on a mission to help 1 lakh healthcare professionals to attain financial security through career into clinical research industry.
Hello everyone. Once again, I welcome you all to Career in Pharma. So today I have a special guest with me. Why special? Definitely he is also a dentist, and other than this, all the speakers which I had till now, among those, Dr. Tarun has more number of experience, more than 10 years into pharmacovigilance, and Dr. Tarun is having, I already said that more than 10 years of experience he is having. So definitely the thing which today we will learn from Dr. Tarun will be, on very much deeper level, right? And so let's begin a sweet, simple, and authentic chat with Dr. Tarun, and we'll start with the introduction of Dr. Tarun. So, hello, Dr. Tarun. I welcome you to Career in Pharma.
Thank you, Dr. Neema. It's a pleasure to speak with you and to share knowledge, obviously for budding dentists. So yeah, looking forward to this interaction.
Thank you, Tarun. And before beginning this, let's me thanks to you from bottom of my heart, because it's Sunday and weekend. No one want to do stuff like this. And we are approaching towards Diwali also. So many things to do at home. But still, you decided to come here, and definitely you will be sharing many things with our audience. Okay, so once again, thanks to you from bottom of my heart. Okay, so let's begin, Tarun. So Tarun, we will start with your introduction. Like, you can go on with your introduction, like when you completed BZ and when you started working into clinical research domain.
Okay, so as you have summarized in the intro, I am a dentist by qualification, and I completed my dentistry from North only in Chandigarh, where after completing the graduation, and like most of the dentists, I was exploring my interest. And to be honest, I was really good in dentistry. I was really good in clinical field, and fortunately, in during our college time, we were the first batch to graduate from the college. So we had that edge that all the patients were given to us. We had a very good exposure in clinical, and all of my teachers generally were very positive about me that I'll set up my own practice or do post graduation. But when you complete your graduation, obviously you come into real world scenario. You see what are your options and how you can settle, and then everything you have to consider your family situation as well. So I would say PV was more of a serendipity to me, because I after completing my graduation, I got to know that there is a pharmacovigilance CRO which is operating in the area, and I should try it. And a few of my batchmates joined there, so I joined there, and then organically grew within the organization. I completed almost 9 years there, and then recently I shifted to another CRO, Seniors Health, where I'm currently working as a director in safety and PV. So I would say it was more of an organic growth, and then I got good opportunities to learn within my previous organization, and then currently as well. So it has been really an interesting journey. And then overall, recently, before joining Seniors, I also completed my certification, Lean Six Sigma Black Belt certification. So which is also a specialized certification for process improvement, quality improvement. So that is how my career shaped up. And currently, as I'm working with Seniors full time and enjoying the work.
Okay. So with this, just now, Dr. Tarun, you said that you started with let's try. Okay, so you started as in the corporate sector. So because you started without knowing anything, definitely, because you want to just give it a try. So after coming to this field, I just wanted to know about the interest part. You developed that interest, or how it was into this field?
Yeah, so I would say, because the scenario 10-12 years back was really very different from the current scenario, because currently we have a lot of tools, lot of sources available to enhance our knowledge, but back then there were very limited resources, because if I share from my journey, I just got to know about this field. I got to know that this is a corporate setup. We'll have to apply our medical knowledge, and then you should try it out. So and then back then there was hiring going on big time, so I just went in for a walk-in interview, and luckily within 1 or 2 days I got the interview call. So after giving my interview, then I was shortlisted for written, and then after that I was shortlisted for the role. And to be honest, when I joined, obviously back then there was a very robust program providing knowledge, basic knowledge of PV, so that was really helpful in setting up expectations, giving us an overview, a bird's eye view, what is the field, and then how we are going to work. And after that I started working as a medical writer. So that was really interesting time for me, interacting with a lot of stakeholders. And then with the corporate setup, because see, if we come with PV industry, obviously we are working towards benefit of the patients directly or indirectly, but within dentistry you have a small world. You have your own clinic, your college, where you interact with patients, but with PV you have world open for communication. So you interact with a lot of people who are based out of different regions from India, different parts of the world. So that was something that really fortunate to have grown. So I shifted roles: medical team lead, senior manager, project lead. So I got really good challenge. That is what that kept me in this field. And then so that is why I missed dentistry somewhere or the other, but I think at the end of the day you should like what you're doing. So I really like what I'm doing. So so that is how I basically progressed within PV. Just to give a simple answer, I was not sure about PV back then, particularly because obviously it was not very prevalent at that time. But I learned within the organization. I did my own research while doing PV, and then ultimately got more interested in this field.
Great. And another, what I feel is because you have to, people are there from different educational background. That is also a beauty. You get to learn other things from different educational background people are there. And other thing is, like, if I talk about
obviously with educational because you are interacting with a lot of people. You obviously you need to have good communication skills. You build connections, you know about people, and then there are various departments. So that is something that is not there in dentistry. Obviously there are different avenues there, but I think that is what something that fascinated me in the initial 1 or 2 years. But obviously after that, when you start working, and then there are different triggers for motivation, different things that you learn, and then that help you basically continue to work in a particular field.
Yeah, great. So Tarun, just wanted to know, like, about your parents. Were they ready for you to do work in corporate jobs? Because I have seen many dentists, budding dentists, when they want to switch to some non-clinical sector, they are not able to convince their parents, because their parents want just to do some clinical stuff which is related to dentistry. So how it was in your case? Like, your parents were convinced or not? And some advice you can give to budding dentists, how to convince their parents actually.
Actually, if I remember back then, there was not much resistance from my parents, particularly because after completing my graduation, as I was saying, that I was a really bright student, so everybody had their eyes on me, that he'll do clinic, and then he'll set up his practice and then everything. But when you obviously complete dentistry, there are a lot of factors that you consider. There's a lot of investment time that you need to put in, and then while you work with private dentists, obviously you get some experience, but these jobs are not that paid well. So for freshers, even sometimes they hire you for on an honorary basis just to observe, and then later on they start paying. That is also very limited. So I had my fair share of working in those clinics, particularly knowing that I had good exposure. I was in my mind, I had my practical skills were really good. So I was really frustrated at that time. I thought that I'll have to put 8-10 years just to establish my practice, and then there is a lot of investment. And eventually my parents were also observing from far that yes, he's trying his best, but yes, there are other factors too which play a big role in setting up practice, and then it is not only based on your knowledge and your skills. So eventually when I transitioned into this role, so my parents were really happy, because particularly I was satisfied with the fact, although they had a hard time explaining their peers to other extended family members, or what am I doing. And then and I also took a lot of liberty in explaining that I'm doing scientific work. So I used to use a very complex terms, so which were to impress others. I am because my first designation was pharmacovigilance scientist. So everybody thought that we are working in a lab, doing some experiments.
So you know what, Tarun, with this, just I want to add one, like मेरे पापा, my father is still, they tell their relatives and friends कि मेरी बेटी अब scientist बन गई है dentist
right. yes so that is what I used to do. But I didn't get much resistance from my parents, because particularly they were happy with the structure of the job, the salary initially that was offered, and when they compared it with the current scenario back then for dentistry. So they were really happy. And then obviously so it was a new field, so they were also inquisitive to know what we are doing and then how this is operating.
Good, lucky, and nice parents. Not every parents understand this thing. I mean, practical reality.
Right, it is difficult for parents, but I think we all need to work on maybe convincing them, and at least telling them that this is our calling, or this is what we should do, and then they should leave it up to us. Obviously they are worried. That is why they say that you because I remember that some of my colleagues really had this their parents really had this apprehension that you should not go into this field, you'll get stuck or everything. So but eventually I think it is us who decide, because we are accountable for whatever decisions we make. So but I can understand most of the dentists generally have a hard time explaining their parents, but this is what something we need to do.
Correct. So Tarun, I was just going through your LinkedIn profile, and I saw you did many diploma also. I mean, before entering this field also, and still at the introduction part you said like Sigma 6 belt also you are, all those stuff you are doing. So for that matter, I just wanted to know from you, like, how much important these certification courses are, because being a dentist, mostly if you're from private college, we think that we invested so many lakhs, now it's sufficient and no need to go for any further certification. So how much important these certification diploma courses?
I think back then, I think in 2011 2010, so these were not that really important, because at that point of time this field was comparatively new, and you were able to crack the interviews, you were able to get through the interview process even with your basic dental knowledge. I still did it because and that is not something I would say that really helped me clear the interview. During the interview there were basic questions about my clinical knowledge, and with PV I had limited knowledge, but this is what something I did just to increase increase my knowledge, because I got into PV, I got into my first job, and then I thought that let me learn about it as well, because during job obviously you get practical exposure, you are working in a particular field, but I thought that let me just explore, let me just see what all fields are there in the field of pharmacovigilance. So that is why I did a diploma. But currently, if you ask me, I think these kind of additional certifications, diplomas are important because obviously fresher jobs are limited. Y- Most of the dentists will have clinical knowledge, so you need that edge. You need that, um, at least on your resume, you need to show that you are inquisitive about the field, because when there are a lot of options, obviously for the interviewer it is also important to see who is particularly interested to work in this field. And then I would say it is also important for new dentists as well to just get to know the field and at least develop that understanding that this is what they are going to do, this is the bigger impact, and then eventually if they are willing to be a part of PV. So that was the initial diploma, but currently I would say definitely, if there are any budding professionals who are planning to join this field, they should definitely look out for any certifications, diploma, or at least do thorough research on internet, because on YouTube as well there are a lot of options available. We were not lucky, like you are providing your guidance at this point of time, you're interacting with a lot of dentists. We are not lucky back then to have that guidance. So I think a lot of sources are available now, and we should make full use of the resources. So yeah, that was for diploma. But for the later part of certification that I did 2 years back was around Six Sigma certification. So that was just to gain more knowledge, obviously, because 10 years back we were operating in a different way. Now a lot of changes have been done, so you need to also be well versed of what are the ongoing practices in the industry, and then what is working well and how we can do things better. So I have been really inquisitive throughout my career. I've been really hungry to learn more. So during my entire association, I've worked with a lot of projects, a lot of streams. So, and that is what basically helped me to pursue this certification as well, because I wanted to learn more about Six Sigma, how we can apply this, how we can improve processes, how we can at least improve the way we are working today. So so that is what basically motivated me to do so.
So guys, for all of you, keep your hunger on, okay, and keep updating yourself, because the in today's scenario, when the world is changing so with a rapid rate, you can't be stuck at a place. Even if I talk about dentistry also, if you are doing the same old technologies, the same old X-ray machines, so even one day the patient will tell you, do you have any RVG or not, right? So keep yourself updated and keep the hunger on. So with this, Dr. Tarun, I want to know that, how did you prepare for interview when you were fresher? What are your ways of, preparing for interviews?
So at that point of time, I didn't get much time to prepare for the interview, because the moment I shared my CV, within a couple of days, I got an interview call. Luckily, there was some hiring going on. So within that limited time, I basically inquired about the field, the interview process from my peers. Some of my batchmates were already placed in the company, and then from whatever limited sources that we had from internet, I researched about pharmacovigilance, and then I also had access to my college library. So I issued a book on pharmacovigilance, although I didn't get much time to go through the entire book, but yeah, it gave me a brief idea of what I am getting into, what is going to be the process. So that really helped me. So basically what I said previously, so from whatever sources you have, you should definitely utilize those sources. Back then these were the sources available to me. I checked on these sources, and then obviously focus was more on clinical knowledge, because back then there was limited knowledge available on pharmacovigilance in public domain, or at least limited courses available, limited free courses available. So with my little research, I think that really helped me to at least get through the interview process, or at least give that message to the interviewer that yes, I am interested. I know about this field, and I'm eager to learn more about this field.
Great. It's a great piece of advice. And you said that you took book from your library and you read about pharmacovigilance. So definitely, Tarun, you are very aware. I can see from your answers also, because you know what, I changed my field, after 7 to 8 years of my clinical practice. So I was totally stuck there. मतलब मैं सोच भी नहीं सकती थी. मतलब मैं ये सोचती थी कि यार 5 साल I treated patient and from clinical background, what I will be doing in a non-clinical role, what I will be doing inside laptop. मतलब मैं सोच भी नहीं सकती थी ऐसा मेरे साथ था. तो I was totally stuck for 7 to 8 years inside dentistry. So
Right.
yeah, good to see that you were very aware actually.
Yeah, but I think that is also need of the hour, because obviously you said that you also shifted to this field. Sometimes we have to obviously work in a certain way, and then we realize, no, for this time I need a break, or maybe I need to try a different field. So that is okay. Everybody has their own journey, and like you're saying, I meet a lot of dentists these days as well who are still unaware about this field. While we keep talking that the sources have
Correct.
increased, there's a lot of knowledge in public domain. There are still new fresher dentists who are not aware about this field. So there is still scope for educating them, at least giving
Correct.
them that basic knowledge that this is what you are getting into, these are the benefits, these are the pros and cons. So this is one. And one interesting thing I would like to tell. So basically my me and my wife, so my wife is also into PV, and we were batchmates.
Okay.
And yeah, my wife also got into the same company
Okay.
two weeks prior to me. So she was also one source of information where she was going through PV training. She gave me some insights that this is what you are getting into. Please decide for yourself if you are ready to work in a certain way. So that was also a great help, because when you are obviously when you get this advice from someone who knows you, or who knows that you are conditioned to work in a certain way, I think that is also something helpful. So while for new dentists, they should talk to someone who they know, obviously a batchmate or a senior, who can give them true advice in terms of how things are working and how they need to prepare for the interview, rather than generic advice that we all get on the internet.
Correct.
That you should read this, you should read that. Yeah. So honest advice is, I think, something that you
Correct.
should. Yeah.
Correct. So Tarun, what were the challenges you faced during transition? Like you practiced for a year, around a year. You practiced dentistry also,
Almost
right?
2 years. Almost 2
2
years.
years.
Yes.
So what were the challenges you faced during that transition phase, like from clinical to non-clinical?
So challenges were, I think, positive in a way, because as I mentioned, with dentistry, you have more personal conversations with patients. You are treating them. You are really keeping a tab on whether they are improving or not, and then you get a call at odd hours that the treatment that you did, they need more support, or they there's a more personal bond with patients, more and you have your small circle in which you operate. But with PV, I think challenges were obviously in a positive way, because that helped me grow personally and professionally. So obviously with PV, you had a lot of departments, you had to interact with a lot of departments. There was new I think the field was new for me, so I had to really spend a lot of time in basically channelizing my clinical knowledge, and basically seeing how this can be applied on paper. Because one thing that you mentioned in one of your previous questions is that generally for dentists, it is more like you are working on laptop, right? But we also need to understand the bigger picture, that ultimately you are contributing towards safety of the patients, right?
Correct.
And that is what you were doing previously. So we are being hired for a particular reason. We have medical knowledge, we have basic knowledge, clinical knowledge that we need to apply. So challenges, I would say, obviously gaining knowledge about new domain was something that was challenging, and that you need to face, obviously, in any new field. And in terms of communication, I had to really bring up my A game in terms of communication, in terms of working with the team, in terms of giving that message that yes, I'm a team player. I will work with the team if there is a project where where they need our support in odd hours, or maybe we need to work overtime. We were there. So
Correct.
so these kind of challenges were there. However, when we compare it with dentistry, it was more on us. We can work whenever we want to, or we can schedule patients whenever we want to, and it was more one-to-one personal conversations, personal bonds with patients and fellow dentists.
Correct. So with this, Tarun, what are the top 1-2 skills that you will advise dentists to have to get into PV?
I think basic knowledge of PV should be definitely there. So either you can gain it through internet, through freely available portals, through CareerInPharma, or any similar portals where you can get basic knowledge. And then one general, obviously computer skills, technical skills are some which are also required, because obviously we have to work on computers, we have to work with Excel sheets, MS Office, so you should be really well versed with the technology that we are using, the basic technology. And one more thing that is required in any field is, I think, learning agility. So that is one skill that you should always be inculcating, because whether you are working in industry or PV, clinical research, or any field, so you should always be inquisitive, always be ready to adapt, because things that are working now obviously might be redundant in coming 5 to 10 years. So I would say biggest is, or general quality or skill is, learning agility. You should definitely have, but otherwise technical skills, you should have basic knowledge of PV and basic computer skills, basic operating skills that are required.
Okay, so with this now, considering you have worked in PV sector for more than 10 years now, so how do you think that PV job market has evolved in India in the last decade?
Yeah, so there has been a big change, definitely, because we have been part of it. Obviously on ground there have been change in regulations, the way we have been reporting information to regulatory authorities, but apart from that, from career point of view, I would say there is also a big change in a way, because previously there used to be more traditional roles. We had these scientist roles, and you had to work in a certain category. But nowadays I think the field has really opened up, because wherever I go and interact with fresher dentists, I generally give them those insights. For example, if you are really good at sales, or if you are really good at business, so there are parallel domains as well. While you gain some knowledge in PV, you can obviously get into business development side of it, or if you are really good at quality, or if your quality skills are really good and you have that interest, you can go into QA, QM, and similarly if you have so basically what all knowledge you have, so it is not limited to doing those case processing, aggregate reports. Eventually you can, like automation is one field which was not that prevalent at that time. So if you're really good with technical skills, if you really understand how computers work, how automation work, what is the current scenario, how coding is done, if you have that interest, because we all are different, right? While we pursue dentistry, we all have different skill set, we all have different interests. Some people are really good at um, uh, providing trainings, so you can also excel in learning domain of it. So I think this industry has really evolved in a way where you are not required to restrict in a particular field. If you have different interest and you are ready to put in extra hours, and you're ready to take that risk, there are definitely a lot of opportunities that you can gain out of PV as well.
Correct. So just now you spoke about automation, Tarun. Now many dentists, and also many, still if I talk about myself also, like I'm into PV now. So I just wanted to know from this automation thing, how it's going to be in coming future. If you do that regular case processing, right? So definitely a little bit of automation has started into few kind of case processing. Like if you talk about business partner cases, so how it's going to affect maybe company will not hire more people, or how it will be? I just wanted to know a little bit about that part.
Okay.
How it's going to affect actually.
Yeah, so this is a common misconception that obviously it will affect jobs, but you need to look at it a way that it will affect job roles. It will not affect jobs. There would still be people required to operate machines, to see whether these are operating in a correct way or not. Obviously, automation will help reduce time or maybe where 2 or 3 people are working, it will require only 1 or 2 people to work on that process. But you also need to see there would be different kind of skill set required, job roles required to test whether it has done correctly or not, or to see whether we need to make it even better or even more efficient. So number of jobs would still remain the same. And if you just look at the internet, so generally in the tech industry, there is a notion that every 10 years the jobs will decrease because of automation. But eventually what is happening is the jobs are increasing. There are more specialized job roles which are coming up, but you have to upskill yourself. So from career point of view, I think obviously automation is there, and it will stay, and further processes will improve, it will become more efficient. But from our side, we need to really be sure that how we can adapt technology as easily as possible, how we can upskill ourselves to be in line with the technological advancements. So definitely there would be no negative impact on people. It is just that you should be ready to learn new skills. You should be ready to keep up with the technology. So that is what I think we should focus on, and that has been a common norm in the industry. If you just see the history of evolution, or at least the modern evolution, you see that there is a very common picture prevalent on the internet, that at one point of time there were a lot of horse carts on the road, and then eventually 10 years down the lane there were only one or two carts you can see, and then most of there were motorized vehicles. So obviously industry was set up, people used to work, people started working in the motor industry or other industry. So there was industrial revolution, more people got jobs. But yeah, the redundant roles obviously were very limited. So if you do not upskill yourself, you do not learn new skills, definitely there are chances that your job role might not be prevalent 10 years from now. But yeah, if you keep on exploring new things and keep up with the technology, I think there is nothing to worry for any person.
Yes. So with this, I just want to add one thing, guys. Keep changing, don't stuck at a place. Change yourself, update yourself, so automation will not do it, not affect your job if you are updating yourself on a regular basis. Okay. So with this, Dr. Tarun, I want to know, like, what is your biggest learning from the industry and any regret you have after coming to industry?
So biggest learning, I would say that I think in terms of we have already talked about a lot of benefits. So biggest learning is that you are contributing to patient safety in some way or the other. You are working towards patient safety, so that should be at core of your heart. So whatever you do, so this is my biggest learning. And my mentor very early on in my career, he mentioned that so that is what you keep in mind while you are doing a single case, or while you are doing even an aggregate report, because ultimately it is going to affect how the patients are being treated in future. So I think that is my biggest learning. You should focus on patient safety. Obviously you have different job roles that you need to do, and in terms of regrets, I think there are no regrets as such, because I'm enjoying my work. I like to do what I'm doing. Sometimes I do miss dentistry, and that is also particularly because I have a lot of friends because from my college, and whenever we have a get together, they all are talking about patients. So and I am the one. There are limited people from PV. So then you feel, yes, I also know this thing, and you feel that what is a modern term called fear of missing out, FOMO. You have that FOMO. Yeah. But I think there are no regrets as such, because ultimately the decisions that we make, we have to own it, and ultimately we are the ones who are kind of owning to our decisions and doing what we like. So no regrets as such. But yeah, I do miss dentistry sometimes, but that is fine, because sometimes you have to choose your career, because some things that you like more rather than other things. So that is one thing. Yeah.
Correct. So with this, Dr. Tarun, I just want you to share anything in specific you want to tell our audience, and not just dentists for that matter, because see, apart from dentists, I mean, all healthcare professionals are eligible for this industry, right? Alternate medicine like Ayurveda, homeopathy, physiotherapists, nursing graduates, they are also eligible. So as any message from you for aspirants who are looking for shifting their career into this clinical research domain. So any message from your side?
So I would advise the freshers, especially who are new to the field, is that you should do your thorough research. You should gain basic knowledge about the field, and then you should give some time to this field. So any career that you choose will not give you success overnight. Obviously, you need to put in energy and effort into getting into successful getting or at least chasing success. So you should always be inquisitive, and that one thing that we have been talking a lot is change. You should never fear change. So obviously there is a difference in terms of traditional roles that you take up after completing your graduation, whether it is an MBBS graduate or a pharmacist or anybody from alternate medicine as well. So it is just that you should keep that thing in mind, that ultimately you are working for patients. That is what your end goal was when you started working in this field, right? And eventually, if you like the field, you should continue, and if you do not like the field, definitely you should pursue other passions. So the one who doesn't try definitely will not know what is working for them or what is not. So you should never be fearful of trying. So always try to explore these things, and do your diligence, do your thorough research, so that you know what you are getting into and you know what to expect.
Yes. It's a great piece of advice, guys. So please don't hesitate in trying. क्या होगा ज़्यादा से ज़्यादा you have to come back to your original thing, right? At least you don't have regret कि मैंने try तो नहीं किया. तो वो चीज नहीं होना चाहिए. And keep changing. And guys, don't hesitate to take risk. क्योंकि कुछ लोग ना, डॉक्टर तरुण, आई हैव सीन दे आर इनटू मेडिकल स्क्रिबिंग. आई गेस यू मस्ट हैव हर्ड अबाउट स्क्रिबिंग, ट्रांसक्रिप्शन, एंड देयर इट्स लाइक अ सेम काइंड ऑफ जॉब. आई मीन वो उनको ऑडियो सुनना है, देन दे हैव टू कन्वर्ट इट इनटू सम टेक्स्ट काइंड ऑफ थिंग इन ट्रांसक्रिप्शन. So now they want to move to clinical research field, because clinical research field is a very dynamic industry actually. Multiple things are there to do. But बात कहाँ पे आती है कि now when they want to come to clinical research, then they have to start as a fresher, because that transcription वाला experience they are not counting inside clinical research. So फिर बात आता जाती है CTC पे. तो उसमें वही मुझे लगता है कि sometimes आपको एक लंबी छलांग लगाने के लिए थोड़ा पीछे भी आना पड़ता है. then that is okay. अभी किसी चीज में अगर आपको फ्यूचर ही नहीं दिख रहा है, तो इट्स बेटर बहुत आगे बढ़ जाने में तो फिर प्रॉब्लम होती है. इट्स बेटर टू go back little, and then you can start with a new fresh.
Right. And moreover, I think very important point that you raised, because if you have to take a leap of faith, obviously you have to take a step back, and then eventually things can work out and things cannot work out as well. There are both scenarios, but ultimately individual situations are also really different. You should not compare yourself with a person who has put 4 years 5 years in a particular field, because everybody has a different journey. So if you are really good at your work, or if you are really good at working in a particular new fields, you can obviously achieve success in 2 or 3 years. You can come up to speed in a short span of time. But if you're not enjoying your work and you keep on dragging yourself just for money, definitely that is not going to help. Eventually it will fire back. Eventually you'll feel stuck. So and most of the dentists generally and most of the freshers generally have this fear, and this is normal as well. But I think early on in your career, this is you should have that mindset that I have a lot of time, I should explore, because ultimately the career that you pick will stay with you for 15-20 years minimum. So you should have that long-term vision in mind, rather than saying that I will have to maybe take a pay cut for 2 years or 3 years, and that will impact my long-term growth. So that is not going to happen. Eventually, if you are good at your work, you can achieve a lot more in a short span of time.
Sure. So really, Tarun, I mean, great piece of advice we got from today. I mean, from you is keep changing, guys. You can see already, Dr. Tarun is still doing new things along with job. Otherwise, he's getting a good salary and into director role. Why he will, update himself? But that is required everywhere. At in today's life is changing so fast. So you have to keep yourself updated, and you have to keep changing yourself, and don't hesitate in taking risks. and trying new things, because when you will explore, then only you will get to know about the thing. Otherwise, and then, if you're not trying, then don't have regret also that, वहां पे कैसा होगा. And if you're looking from far और मन कर रहा है, तो just give it a try. कुछ इसमें harm नहीं है. You can always come back to your original dentistry, not an issue, but give it a try at least. Okay, so thank you once again, Dr. Tarun, for coming here and giving so much, lovely piece of advice to our audience. And Dr. Tarun, I want to tell you that definitely many people will be contacting you through LinkedIn, I feel, after this video, because it happens naturally. So maybe we will share your LinkedIn profile in the description. Okay, and yeah. So yeah, with this, we'll conclude this interview. And once again, thank you, Dr. Tarun, for coming here.
Thank you, Dr. Neema, for having me, and always there to support. So as you said, in case
Thank
anybody needs any guidance, well, I'll be happy to be available to provide that guidance. Yeah, thank you.
Thank you, Dr. Tarun. So with this, guys, we will conclude this interview, and please, please, please like this interview if you like it, and also please subscribe to our channel, and we will be coming up with more interviews like this, and we'll be sharing journeys of other dentists, other healthcare professionals also with you. And if you like any other video or any topic for me to discuss with you, then please comment in the comment section. Definitely I will be coming up with some new video. Okay, so till then, stay safe and stay healthy. We'll see you soon. Bye bye, everyone.